This is Dr. David Fantarella of the Fantarella Dental Group, where we use tomorrow's technology today. I'm going to show you a case of a 20-year-old patient who lost a crown on tooth number 10. The crown was lost because the tooth was just short and will not hold the crown any longer. We first removed the existing crown that was temporarily re-cemented. We were able to use the Solea laser to lengthen the crown, scan the tooth with the E4D CAD CAM system, design the crown, mill the crown, custom stain it, and cement it within a couple of hours. Because we were able to make the clinical crown or tooth longer, it allows the crown to adhere to the tooth and last. As you can see, immediately after the procedure, there's just a little bleeding, and a few months later you can see the tissue completely healed and the crown looking great. Traditionally, what I performed on this patient would have been done in multiple appointments over several months. We were able to do it in one visit in a couple of hours without discomfort. Thank you for watching, and if you would like more information about this procedure or any others, please visit our website at fantarelladentalgroup.com.